All right, thank you for joining us for today's event on medical review of CT scans of the abdomen and pelvis. My name is Mary Sue Gardner. I'm a registered nurse on the Provider Outreach and Education team, and I'm going to be your facilitator for today's event. I'm also joined by other members of Provider Outreach and Education. Jennifer, she's going to be my co-host and running things in the background like the chat and helping with any technical issues if they come in. All right. My overall objective for today is that you learn about the findings in the targeted probe and educate reviews that we're currently conducting on CT scans of the abdomen and pelvis and what's causing those denials. If you can learn what's causing, you can help avoid the denials in your facility. So we're going to achieve this objective today by identifying what we're reviewing and the CPT codes associated with that. We're going to review the coverage criteria to support the services. And we're also going to review the documentation requirements for these types of scans, as well as discuss the review findings and how to avoid them. All right, so what are we reviewing? Let's first start with the codes that are under review in Targeted Probe and Educate. These codes include the 74176, which is CT of the abdomen and pelvis without contrast, as well as CPT code 74177, which is CT of the abdomen and pelvis with contrast. Reviews are conducted on the 74177, which are going to focus not only on supporting that CT of the abdomen and pelvis, but also supporting the use of contrast media in that scan. So we're going to look through the documentation to support the medical necessity of the scan, that it's signed, that there's legible orders for the service, etc. We also have to check and make sure it's billed appropriately. So remember, you can only bill one CT scan of the abdomen or pelvis for any session. And if you are billing for the contrast, it must be documented. And we're going to break all of this down more as we go through this presentation. But first, let's move into the why we are doing these reviews. We're reviewing because the data supported the need. Everything comes down to data. So basically, the data we ran identified these codes actually pose a significant risk in the total dollars of at risk, which were greater than 99th percentile, and the total dollars at risk per claim being greater than the 50th percentile. So our data people analyzed this data further, and then they identified the top providers that are posing the greatest risk to have a potential to bill this service inappropriately just because of how much they bill. The data showed that these services in our J5A jurisdiction pose the greatest risk. Now, this doesn't mean that J8A providers that you're off the hook. This actually is giving you a one-up, so you can learn about what we're looking at, what's causing the denials, make any changes in your facility if needed. Then if we happen to expand the review to our J8 jurisdiction, then you're prepared and you should pass a review with flying colors. Now that we're aware of why we're doing this and what we're reviewing, let's move on to the coverage criteria and what we're reviewing for. So starting with some background information on CT scans. CTs are an image produced that take a series of x-rays from different angles, and it creates a 3D image. Now, we use CT scans in the medical community to help diagnose, to plan things, to monitor treatments for our patients. Medicare covers CT scans when they are ordered by a physician, medically necessary, and performed on approved equipment. So ordered by a physician, medically necessary, and performed on approved equipment. When we do reviews, we also use the national coverage determination, which is linked right here on your slide and in the slide deck to complete those reviews. So I touched on this a little bit in the last slide, but let's dive into this a little bit more. Diagnostic CTs of the body are covered by Medicare if they're ordered by a physician, medically reasonable and necessary, and performed on approved equipment. But what does all this mean? So reasonable and necessary, that's one of the hardest things for people to understand, especially when it comes to Medicare, because it's a term we use all the time. So let's talk about the medical necessity part a bit first. So first, if the service needs to be ordered by a physician, but a physician order alone does not make that service medically reasonable and necessary. So what does reasonable and necessary really mean? It means it's safe and effective. It's not experimental. It's not investigational. And it's appropriate in terms of duration, frequency, and it falls within consistency of acceptable standards of medical practice. Further, it's furnished in an appropriate setting by qualified personnel. So one that meets but does not exceed the patient's medical needs. It is medically appropriate considering the patient's complaints and symptomology. Is the use of this procedure helping to lead to the primary diagnosis? That's a question you should ask yourself before performing these procedures or ordering those procedures. So when we look at documentation, we look to see if it meets medical necessity. Again, just because something's ordered by a physician doesn't mean it's medically reasonable and necessary. So I wanted to really hone in on that and drive that home with you. I do want you to keep in mind, besides medical necessity, we also have to look at your billing and ensure you're reporting the codes properly and only one per session is being reported. Now, for review purposes, we have to assume that the models of the CT equipment used are on the approved equipment list. But as an FYI, the state can and oftentimes will come in and audit your facility for this. But just so you know, there are indications regarding the approved equipment list in the national coverage determination. And again, that was linked back a slide or two ago, and it's also linked again right here for you. And I'm not going to go into this, but again, it's on your slide and I've provided that link. And I do encourage, if you do these services, to please go out and read that NCD. Most of you don't have to worry about it. Most of you do your services, they are medically necessary, they are provided in accordance with Medicare standards. But if you are considering upgrading equipment or getting new equipment, you will want to refer to the national coverage determination and make sure that the new stuff is on the approved equipment list for you. Finally, finishing off the coverage criteria that we look for, there are place of service indicators that must be met. So if you are hospital-based facility, so hospital-based, the coverage criteria states that the radiologist or other qualified physician is responsible for the procedure. Basically, that they are in charge of, and I'm doing air quotes around in charge of the procedure. They don't need to be the one running the machine, but they need to be the oversight of the procedure. As a facility, you must have documentation showing a physician with hospital privileges ordered the scan and a radiologist or other qualified physician is responsible for the procedure and its interpretation. So this includes ensuring all orders have the necessary clinical information. The physician performing the interpretation is also must be approved by your facility, by your hospital, and the appropriate supervision levels for your type of service, that you are meeting those and that those are documented as well. When it comes to ambulatory settings, so somewhere other than a hospital-based facility, like a freestanding physician-directed clinic, the procedure must be performed by or under the direct personal supervision of a radiologist or other qualified physician. So Medicare considers direct supervision as the physician or practitioner has to be present in the facility and immediately available to provide assistance and direction throughout the service, though not necessarily in the same room. So it's different from line of sight. They just have to be present in the facility and immediately available. So at this time, let's do something different than I usually do. Let's do a little knowledge check. I am going to open a poll, and let's see. Jennifer, can you verify if you can see the polling questions?
I can't see it on your screen, but I can see them on the slide.
That is not the one I want to pull in. Let's see. I launched the poll. Now I'm going to see. I'm going to check the chat. If someone listening can put if they can see that poll question launched on their end. I do have 41% have finished, so it is, I see that it is visible. Yes, I was able to answer. Thank you. Thank you to Nicole and Cheryl for pulling that in. And so the question is, Medicare covers CT scans if they're reasonable and necessary, ordered by a physician, and performed on the appropriate type of equipment. So we're going to close that poll. And I'm going to move on to poll question number 2. And I'm going to open the next poll. What CPT codes are included in our claim reviews? So go ahead and answer that. I'll give you just a couple seconds here. And I see we've got the majority have started. And finished. And we're going to go ahead and close that poll. And the answer to that is both the 74176 and the 74177 are included in our reviews. Okay, moving on to question number 3. How many CT scans of the abdomen or pelvis can be billed for any session? So any session. And we only alluded to this, you know, just a few times, but I think it was enough to drive the answer in, because it looks like the majority of the answers are correct. We're going to go ahead and close this poll. And the correct answer to that one was 1. So 1 can be billed per session. And do just a few more questions here. The next question, opening the poll. In a what type of setting a radiologist or other qualified physician is responsible for the procedure? Ambulatory, mobile, hospital, or Those are your only options. And we got just a few more coming in. And I am going to go ahead and close the poll on that one. And the correct answer to that one is in the hospital setting. So in a hospital setting, remember, a radiologist or other qualified physician is responsible for the procedure. They don't have to be the one necessarily running it, but they're the oversight of the entire thing, basically. They're the big dog in charge. And finally, one last question. I'm going to go ahead and open this last poll. And the question is, if mobile CT scan services are furnished at an ambulatory healthcare facility other than a hospital-based facility, the diagnostic procedure must be blank by or under the direct supervision of a radiologist or other qualified physician. Performed, initiated, dictated. And answers are coming in. Got a few more in progress. It looks like everyone has finished answering. And we're going to go ahead and close this poll. And the correct answer to that one is performed. So the CT, the mobile CT services, the mobile CT scan services are furnished at ambulatory health facility other than hospital. The diagnostic procedure must be performed by or under that direct supervision. Okay, so we're going to go ahead and I'm going to move this over for me, which you guys can't see, but it kind of obstructs my view on my end. And we'll ask a couple more questions a little bit later into the presentation, but it looks like the majority of you learned all the answers, so perfect. All right, let's move on with documentation. So those of you that are on the call that are clinicians know that old mantra. If it's not documented, it's not done. And nothing is more important when you are in a medical review capacity than to be able to find the documentation that the services are billed, and they're billed in accordance with Medicare standards. For review of these services, the following items listed here on this slide are the things that we ask you to submit when we review your services. So here is where a Part A facility and a Part B physician's office may have to, and I'm air quoting again, play nice together. We are reviewing the facility, but some of the information that we may need may reside in the physician office. So it's your responsibility as a Part A facility to get that information if you need it to help support the services as reasonable and necessary. So this may include things like a H&P, progress notes, etc. The H&P and progress notes generally support the symptoms and any preliminary diagnoses given. So these help demonstrate the need for the service. Now, the physician office may send a preliminary diagnosis along with the order and the request for the scan, but they may not send any kind of background like a H&P or progress note to support this. So you may need to ask them for those items if you get called upon by medical review or any government entity review for these services. Other things you may have to have in order are things like orders, the results of the CT scan, the documentation of if you use contrast media and what kind of contrast media and how much. Finally, if you have reason to believe that Medicare would not pay for this service for this beneficiary on this day, and you happen to issue an ABN, then we ask you to submit that to us as well. And then there's a question. Let me just look over. How do you support medical necessity for a CT scan for monitoring for cancer patients for a routine scan after treatment has been received when it's not due to symptoms? And if you're doing a CT scan for monitoring, are you running into issues with denials on that? I'm just gonna try to get some information from the person that's asking the question. Basically, the documentation, as you type in if you're monitoring or if you're getting denials, the documentation needs to support what the service is being provided for. No, you're not currently getting denials. Okay, so what the service is being provided for. And if it is to check on the cancer and to monitor the progress of the treatment that's being provided, that would be the documentation that we would be looking for to support the medical necessity. We would look to see what types of treatments you have provided. So that would be information you would probably get from the physician's office. What your expectations of that treatment were to be, if it is reduction in tumor size, elimination of tumor, et cetera, et cetera. So what you're hoping to get out of the treatment that you are providing for it, and then why you are monitoring those symptoms. I don't know about any kind of modifiers or anything. That's not my forte, but if I find something more specific, I will just blast that information out to everyone. All right. So as we move on, we're going to go to another knowledge check. So I'm going to give another poll, and let me open the poll here. The H&P and progress notes must support blank and blank. Must support blank and blank. This one's a little bit tricky in the way that it's said. But it looks like we're done answering. Okay, so in this one, the H&P and progress notes, they support your symptoms and your diagnosis. So the H&P, and I said this, back on the last slide when we were talking about the documentation requirements. The H&P and progress notes must support the symptomology your patient's having and any preliminary diagnoses given. And these really help demonstrate the need for that service. All right, and then one last question. And let me open this poll. And the documentation must include imaging, orders, and what? Looks like we just have a few more people that are in progress. And we're going to go ahead and close this poll as well, looking like everyone that took this got this one right. And the correct answer to this was results. So I said back again on the last slide, other things you may have is, orders and results, but really when it comes down to the documentation of the imaging, we need to specifically see orders and results of the scan itself. So great, looks like everyone got that correct. All right, let's move on then. And we're going to finish up today by discussing the medical review findings. So you know how to avoid having a denial happen to you if we happen, to come knocking on your door at Medicare and we want to look at your claims, or any other government review entity wants to look at your claims. So I've given you the denial reason codes, but I want to explain to you, and the information again here is on the slide, about what it actually means. So the GA101, this reason code, this denial reason code, basically means the provider did not submit all requested records. Most often forgotten is a physician order for the scan to be performed, but it could include any other types of documentation that we requested. So it could include the results not being provided. And you can use the link that's provided in the slide deck here to go back to that slide on documentation requirements and view what those documentation requirements were. So I just went back, and now I'm just going to catch us back up to where we were. All right. The next denial is the GA103. Similar to missing documentation is incomplete or insufficient documentation. And this is generally when a component of something is missing. Like, we got the order, but it wasn't signed. Or you submitted the progress note, but it didn't demonstrate the need for the service. Also under this category could be when you have to support the person, such as the radiologist or other qualified physician was responsible for the procedure. Maybe we didn't get anything to show their portion of that responsibility. Maybe we have no indication that, you know, the scans were even read by a radiologist or other qualified, you know, physician. We just get an unsigned result. Again, just like documentation, you can use this link, and it's going to take you back to the coverage criteria if you wanted to review what all those coverage criteria are. Moving on. Next is the GA105. This is missing signed physician order or documentation to support intent to order. So in the absence of a signed physician order, if it's obvious from the clinical progress notes and or maybe the H&P that the intent was to order the scan, we could consider that. But it's got to be very obvious. But so, you know, a big thing here, if you have a physician order, make sure it is signed. If it is signed electronically, make sure when you print that documentation to send to that medical review entity, make sure it's evident that that electronic signature appends to that order as well. There was an issue several years ago where there was a certain electronic health record type of program, and when they would print it to submit for medical review, the signatures all landed on one sheet, and they didn't append to where those orders were, where those progress notes were. It was just a whole long page of signatures, which you couldn't match up to the right thing. So make sure that is not happening in your facility. All right. Next issue. Under the GA107 is the fact that the documentation did not support that the signature requirements were met. And we just kind of talked about this with the GA105. So verify all entries in the medical record are signed, make sure they're dated, make sure they're legible if it is hard copy. And again, if you want more information on signature requirements, you can find it in the link that I am going to put in the chat right now and pop that off to you. And that is a CMS booklet on signature requirements. And I encourage everyone to read that. Anyone that does any kind of medical documentation should have that in their back pocket. All right. And then our last issue is the 56900 denial reason code. So this reason code is for no documentation received from the ADR request. Remember, you have 45 days to respond to an ADR request. When a targeted probe and educate is started with your facility, we notify you that it's going to start. We also provide you with a letter notifying you of this and notifying you of what reason code you should be looking for, you know, if your documentation hits an ADR request. You should have someone watching your claims for this service, for any claim that hits that ADR request, and make sure that you are responding appropriately, because missed submissions will cause denials. So no documentation received denials. All right, and then as we move on, let's talk now about how we can mitigate some of the risk of receiving a denial. There are some questions that I challenge you to ask yourself when you're billing for this service. Have we chosen the correct CPT code for the scan provided? If there was contrast, did you report the contrast code? Was the scan performed? If it was in an ambulatory setting, then further questions to ask. Was a diagnostic procedure performed by or under the direct personal supervision of a radiologist or other qualified physician? Is the attending physician order for the scan performed, for the mobile unit? More compliance questions here. Was the scan in a hospital? If so, does the documentation support that the radiologist or other qualified physician oversees the procedure? Is all the required documentation included for review? Those that were listed, not only here on the slide, but also back on that previous slide on the overall documentation. So did you submit everything? There's also documentation requirements listed on your ADR as well, so make sure you are checking all places. And then the big question you should ask before you bill: is this scan reasonable and necessary for this patient on this day? Are the reasonable and necessary services supported in your documentation? So do you have symptoms? Do you have a preliminary diagnosis? Do you need to get more information from the physician's office before you bill this service? All right. So now let's recap before we get to open questions and answers. We went through a lot of information today, but we really just wanted to specifically focus on those two CPT codes that are under review, and to help everyone, not only the people that are on these reviews, but everyone to, not have future findings. So today we've learned about what those actual review findings are that are causing denial of service for those people that are under review. And we accomplished this today by identifying what CPT codes are under review. We went over the coverage criteria. We really talked a lot about documentation and those review findings and how to avoid them. And then we explained how compliance can help mitigate overall risk. So at this time, we're at the end of our presentation. I'm going to look over to see if there are any questions in the chat that have not been answered. And I'm scrolling through, and I'm not seeing anything. All right. So what I'm going to do is I'm going to continue on in the interest of time, but if you have a question, go ahead and place that into the chat. Now remember, it's here that I also want to encourage you to make sure you're looking at those notes in your slide deck, because there's information about how to submit questions after the event if you were to have questions. We value your opinion, and we want to hear from you on how we did on this event. So the survey for this event only takes a few minutes to complete, and that's why I want to give you the opportunity to take it now while this webinar is still in progress. It's also an opportunity for you to tell us what additional education you would like in the future. So many of the educational events that we provide are actually a direct result of these requests. So be sure to read the responses carefully. And, you know, it only takes a little bit of time. And CMS, if you've done these surveys in the past, CMS has decreased the amount of questions in the survey. So good thing to know. But we do value your opinion. We want to know your opinion for each and every event that we're doing and if it's valuable to you. All right, finally, if you think of any questions regarding the event, please email those to us at wps.education@wpsic.com. That information should also be in the notes section of your handout, and send those to us within the next week. Please make sure you don't send any PHI or PII. And remember, we don't have access to the claims processing system. So if you need to find out something claim specific, you do need to take those questions to customer service. And, you know, again, remember, check the notes section in the slide for any additional information that we want you to know. So on behalf of Jennifer and myself, as well as Medical Review, I'm not seeing any more questions. So I want to thank you for your participation in today's event. This concludes our webinar, and you may now disconnect.